Hello, ladies and gentlemen. Thank you very much for joining me today on this live webinar from the great state of Texas in the Hill Country north of San Antonio. And it's very hot here, and this is summer. And during this period, we have more heat in the air, more heat in our body, and thus we have more cases of heat-related, or in Ayurveda we call pitta-related, or pitta-vrudi, high pitta conditions during the summer. So this subject is very suitable for this time period. We're getting a lot of cases here every single day of acid reflux, GERD, as it's known, gastroesophageal reflux disease. But we'll just call it acid reflux or heartburn in this case. And we're going to talk about some of the long-term harms of this condition. We're going to talk about common symptoms to be able to identify it. We're going to talk about, of course, the causes, which is the most important subject, is to understand the causes. And then, of course, we're going to talk about both dietary changes, which are very important in this case, some lifestyle changes, and, of course, herbal remedies, because there's an herbal remedy for every condition. I've been very successful with this condition. I, in the past, have had it myself. I have to be careful myself about getting acid reflux or heartburn. So, having the condition yourself makes it so you get very good at treating it. And I think I have a high success rate. There are a few causes like stomach infection, like H. pylori, which can also cause this condition, but we're not going to cover those in detail. So first, let's talk about, some of the symptoms we have of heartburn. And we could say there's two types. We could have heartburn, where it's coming up the esophagus and we feel the heat and burning. And we can also just have, and we usually feel a sour taste in the back of the throat, or even a burning sensation on the back of the throat. And then there's just a throat burn, we could call it too, where it's not coming all the way up the esophagus, but we still feel a burning in the throat. So, and there's different degrees of this condition. We cannot say that, there's just one type of heartburn. Some people have what's called silent GERD, where they don't even really know they have it. There's other symptoms that can indicate that you have it. But in all cases, we have to take this condition very seriously, because it can lead to, first, stomach ulcers is probably the most common problem of long-term excess stomach acid and less stomach mucosa. We can have an ulceration in our stomach. That's even more painful. And of course, this acidity and sour continuing to regurgitate up, it goes past this, this lower esophageal sphincter, which is a type of valve that's supposed to prevent the acid from coming up. Your stomach's on the left side. Your whole abdominal area is not called a stomach. Your stomach is just a stomach. You have the liver, gallbladder, small intestines, large intestines, and that makes up your whole abdominal area. So when we speak of stomach, we mean under the left rib here, the kind of pear-shaped organ that has stomach acids in it contained by stomach mucosa, which protects the stomach from, the acid, which of course is used to digest our food, particularly for digesting and breaking down protein. And when there's less mucosa or excess stomach acid, then we can have this condition. And of course, the valve can be damaged, the throat can be damaged. Like I said, you can get tooth decay, tooth can be damaged from this acidity. There can be scarring to the throat, which can take years to recover from. And ultimately, you could have throat cancer from chronic acid reflux or heartburn that's not treated. Other symptoms besides the burning, in the chest, or burning in the throat, or the sour taste in the mouth, can be difficulty swallowing. And this comes from the scar tissue that's developing over time. And also a dry cough. It can affect the respiratory system, and you can have a dry cough. Also, it can contribute to constipation as well. So, like I said, it's a low stomach lining, which in Ayurveda we call kladaka kapha, which is the kapha or mucosa lining the stomach. Oh, and or high panchaka pitta, which is the acid and fire in the stomach. And of course, the name for this condition in Ayurveda is called amla pitta, sour fire, sour pitta. So we're going to talk about some of the causes. The number one cause is probably bad eating habits, waiting too long to eat. And then, the stomach acid accumulates, and then you have a big meal, and then the stomach acid goes around the food and up the esophagus. Also, having too much sour food, sours like lemon, lime, grapefruit, vinegar. This creates more stomach acid and also diminishes the amount of mucosa in the stomach lining. For example, we have a floor cleaner that's made from lemon peel oil, and it can really clean the floor quite well, because of course I would never use bleach. I don't allow it in my house. It's toxic, it's poisonous. I have doves, birds, cats, chickens, dogs, and last thing I want in the house is any bleach. So I use this lemon cleaner, and it just really cuts through the grease. Even in my dishwashing liquid has got you'll see some of them have lemon in them. And so this lemon or sour cuts grease and reduces in your stomach the mucosa, which is protecting your stomach lining. Like vinegar, you can also use vinegar to clean the floor. So if you have too much sour foods, fermented foods like pickles, a lot of vinegar, then and you have very little things that build the mucosa like dairy and other demulcent foods that create more lining, kapha building, then you can get this acidity. So just from the type of foods that you're having. Now, when you understand it from this point of view, you can see that there's two types of this condition. One type is the person has excess stomach acids, and the other type, the person actually has low stomach acids. And when you have low stomach acids, you can still get the acidity because eventually the acids do build up and you don't have enough stomach acids and you're eating, and then the acid starts forming after you've already started eating, and then you get this kind of delayed acid reflux that's coming. And also this little valve, this sphincter valve, can not close properly, can be damaged from the past acidity. So that in this case, this type of person, they only get the acidity when they lie down. So they eat a meal, or they have something sour, pickles or sauerkraut, and they increase the acidity, and then they lie down and the valve doesn't close properly and the acidity comes up. So we'll break it down into those three categories. The valve not closing, which is really a separate subject, and it needs some time for the valve to heal, and low stomach acids, which is less common. And this type of person, they can take a little apple cider vinegar, they can take a little sour food prior to the meal to get the acidity up a little bit so they can digest the food. The person with the low stomach acids, they'll feel heavy and sluggish and then get the acidity. So as they didn't have much in the beginning of acidity, they ate a heavy meal, they feel sluggish and heavy after the meal, and then they get acidity delayed. Now, the most common type, and the common type we're going to talk about, is the person who's maybe got pitta prakriti or pitta vikriti, where they're already a type of warm person with a strong appetite, good stomach acids, good digestion, and they're just getting excess acidity. That's like 90% of the cases. The only other type, which we're not going to cover today, is if you have a stomach infection like H. pylori. And this can also create stomach acids. And the treatment is completely different because we have to fight the infection as well as manage the acidity until the infection is gone. So there are a few causes, but the main cause we're going to talk about addressing here today is this typical person who has traditionally a strong appetite, long history of acidity, and it's not just only happening when they overeat, or not just happening when they lie down, but happening mostly when they have hot foods, sour foods, spicy foods. So in this type of person's case, the first thing you want to eliminate is all these sour fermented foods. We get many people are drinking these fermented drinks and having a lot of kombucha and sauerkraut and kimchi, and they're very typical type of case where they're having this daily, and then they start getting acid reflux and GERD, and unfortunately they don't connect the two together. But this can be a cause. Also, spicy food, hot food, chili pepper, cayenne pepper, even too much black pepper will diminish the stomach mucosa in the stomach lining, and then can create more an environment for more acidity. So in most cases, we want to avoid sour foods, hot foods, and have foods that increase the stomach mucosa. And what increases the stomach mucosa? Probably the best is just raw whole milk. You've known people, even any type of dairy product besides a fermented dairy. A yogurt isn't going to work as good because it's fermented, but you know, many people have found great relief from having raw milk, including myself. I used to get a little acidity in between meals, or sometimes I'd just go to bed and I'd feel the burning. I have a cup of milk, gone. And what I'm doing is I'm just like coating the whole stomach. I'm neutralizing this acidity that's built up because I generally have a strong appetite and I need to eat. So this type of person is usually Pitta type of person like myself, Pitta, Vata, Prakriti for myself. And we have strong appetites, good digestion, don't tend to like spicy foods too much, but we'll eat them anyway because we don't know how this can adversely affect us until we learn about it. Or over time, a lot of people like myself, you know, we're eating spicy foods when we're young, and then we realize this is not working. This is giving me acid, increasing my appetite too much, making me hangry. And if I didn't eat, then I'd get the acidity. So that's the type of person we're talking about today, who doesn't eat and gets the acidity, not the type of person who overeats and then gets the acidity. This is a different type of case. That's more of a kapha, heavy person, overweight person, and more kapha, and a dull or manda agni type person. And so they have this dull digestion, but then they can get the acidity because of the lack of stomach acids. Completely different treatment. But this is only a small case, and they're very easy to identify by the fact that that type of person usually has low appetite, then overeats and gets acidity later. And the person like myself, or a typical person, has strong appetite, can eat almost anything because they've got these great stomach acids. But if they don't eat, then they get the acidity. And that's what I've had to do for decades, is just have some milk. You know, people in bars often, they drink, have a little, when they drink alcohol, which creates more acidity. I didn't mention that, but alcohol, particularly hard liquor, will dissolve the stomach mucosa lining and create more acid reflux. And many people who drink are well aware of this. So, and the bars are aware of it too. So people who drink often eat cheese first. The bar will give you cheese, other oily little things like olives and cheese. They don't give you chili peppers and pickles. No, it's going to not be compatible with the alcohol. So if you eat a little cheese first, a little piece of cheese, drink a little milk, and then you have your alcohol, then you don't get the acid reflux. And I know many people who told me that they do this, and this is why bars like to give you a little cheese so you can have more alcohol and not damage your stomach or have too much acidity in your stomach. So it is finding this little balance between acidity and stomach mucosa, or hydrochloric acid and stomach mucosa. There's a little balance. So in Ayurveda, we wouldn't call it a disease. We call it an imbalance. And it have to be determined, what is the imbalance? Is it too much stomach acids from sour foods or vinegar, or is it too little stomach mucosa, which comes from often not having any dairy, no milk, or nothing to coat and protect the stomach lining? So, you know, this is a case-by-case situation based on the individual. And you have to know the individual, hear what they're eating, what their habits are. But most every case, they're having some sour foods, vinegars, fermented foods, and that tends to be the big cause. And then just a little bit of cheese in there and removing the sour foods will generally do the trick. at least to prevent it from coming back. Unfortunately, people don't have the patience to wait for these dietary changes to take place. It can take some time. So we generally treat it right away. And these people are very happy. They get good results. So we're going to talk about a few formulas we use here that are very effective, like immediate. Of course, we have a formula, as Ayurveda has formulas for everything. And we're going to go through some of these herbs right here. There's our acidity formula right there. Ooh, nice, clear picture. You know, that's the new one. See, we've changed it. It's got new there. I don't know. Reduces and controls acidity. It works very good, very good. I mean, it's like a natural Tums. We're going to talk about some of these herbs too. Shatavari, very cooling, sweet herb. Guduchi, an anti-inflammatory cooling herb. And guduchi sattva, which is the juice of the guduchi, and a little fennel. So we're going to talk about those to better understand how they can treat you. Let's start off with shatavari. Now we have shatavari in many forms. We could even make it into a tea. Shatavari root. It's a white root. It's very sweet. It's very cooling. You know, a lot of Indian herbs taste bad. But not shatavari. It's sweet, and it's a demulcent too. See, we want the demulcent quality to create the coating in the stomach lining. We have other, it's also in this form here, shatavari. It's a sweet powder. Yep. Of course, we're getting organic at all times. And other demulcent, and there's the fennel. Oh, that's this fennel powder. It's also sweet. And also a little home remedy is chewing a few fennel seeds after a meal. And I leave these on my desk because, you know, I can get a little acidity sometimes. So I just take a big pinch and kind of like suck on them, get that sweetness out of them. And that just cools down my appetite. That's why Indian restaurants put candy-covered fennel seeds at the door. They candy-coated, but traditionally it's just fennel seeds. And they should be fresh. Those were a little dry. They should be fresh and soft and sweet and feel good. And they put down your appetite. They prevent acid reflux and GERD. And it's one of the simplest home remedies. In fact, you could just make a cup of tea, fennel tea. So if you're getting acid reflux, and it's just sometimes, if you get rid of the hot foods, the spicy foods, the sour foods, and don't delay eating too much, too long, and then afterwards you just have a little cup, half a cup of fennel tea, that may be enough for you. Now, if we want to increase the amount of here's guduchi. If we want to increase the amount of mucosa, then we can add demulcent herbs. Demulcent herbs, let's see. Oh, here we go. I did bring one. So we got a lot of different demulcent herbs. This is slippery elm, marshmallow root, even shatavari, fennel to some degree are demulcents, creating a coating, a lining. When you have like slippery elm or marshmallow root, and you just chew on it, your whole mouth is just covered in like the slimy coating. So we use that to coat the stomach lining as well. And here's guduchi. Now we also saw it's a stem, very cooling and very anti-inflammatory, and used for a lot of different conditions. Here is and guduchi sattva, as I mentioned, I don't have it here. It's a white powder, very expensive. And guduchi sattva is like just the dried juice, so to speak, of the guduchi. It's just very fine and very, very cooling powder, and you don't need much. We also have a tea, and the tea, usually the acid reflux formula, it usually goes right after meals. But the tea, oh yeah, here's the acid reflux formula. We usually take it straight after meals to avoid acidity. But if people get a little burning or abdominal pain between meals, we often send them this to calm belly tea. Now, it helps with that, avoiding heartburn, acid reflux. And if you look at those ingredients, alfalfa is very alkalining. Cat's claw is anti-inflammatory. And lemon balm, it's of the mint family, but there's only a little bit in there. And chamomile's anti-spasmatic. And there's your two demulcents, marshmallow root and fennel. It's a very bland tea. It doesn't have hardly any flavor. It's just a bland and coating. But we use this tea for a few other issues as well, like abdominal pain, cramping. But the combination of, changing the diet, changing the eating habits, and taking these two will work about 90% of the time. And once the person has it under control with the herbs and the diet, if they follow the diet, they can keep it under control. Now, like I said, there's varying degrees of it. If people like myself just get it sometimes if we have spicy food, because often we don't even follow the advice which we know we should follow, like no sour foods, no spicy foods. If I go out to a Thai restaurant, or I go out and I'm going to have some spicy food, but I only get a little acidity, I never get it really bad, then this is what I generally take. It's called Pitta Post Digest. There's a shatavari and there's a guduchi, but there's another formula called Practitioner, and Practitioner is a digestive aid that's not hot. Chikrat is 12 herb. Chikrat Mool is a premier digestive aid. Mool, it means root, and it is a little warming, but there's only a little bit in it. So it really more avoids acid reflux, and it improves the digestion. The difficulty we have with the acid reflux formula is that it will just snuff out your digestive fire very fast. It's just like a Tums. So we don't want it. That's only in the case where there's really chronic acidity. 9 out of 10, I can give people this formula after meals, like myself, and that does the trick. Some of the same herbs. Now, if they're getting a lot of pain, there's burning, acidity, plus abdominal pain, then that we use this, and we're going to talk about this abdominal pain relief formula. And there's a shankhpushpi in it. And guduchi. Guduchi is the anti-inflammatory, as we mentioned a few times there. And then shankhpushpi. Let me show you shankhpushpi. Here it is. Shankhpushpi. It's from a shell. So it's really like a Tums. It's just a chalky substance, and it feels good if you're having a lot of pain and burning at the same time. Particularly if a person's this abdominal pain form, we can use this one for the stomach ulcer. So it's actually a more progressed condition. Now you've got a stomach ulcer and burning and pain in the stomach, and maybe even abdominal pain in the small intestines. I mean, it's a more advanced condition. Then we'll use abdominal pain formula. And also we can get some other kamaduda. Kamaduda is also a formula we use, kamaduda Ross, and it is a mix of cooling pitta bhasmas, including inside of it is pishti, which is coral calcium. So this is also used in some of these formulas. We have a formula called Pitta Balance, which is also used, and it has these in it. Now, see, this is when a person has excess body heat, burning sensation, and then you can see we got kamaduda Ross, this first one, pishti, muti pishti, which is the powder of pearls, very expensive, panchment, which is 5 things from the ocean, and there's that guduchi sattva, which is super cooling. See here, we don't even use guduchi, we just use guduchi sattva, a little bit of licorice, a little bit of fennel. So this one also helps with acidity, but this one is for the person with a lot of body heat. They're hot, they're sweating, they're fever, they're burning up, even their muscles are inflamed and painful, and they can hardly have trouble walking because the pain is so bad, plus acidity. Then we give them Pitta Balance. Now, and to keep it down, sometimes we just want to get extra shatavari in them, because shatavari is a cooling, demulcent herb that's very good for just balancing pitta, which is the underlying cause here is pitta, particularly panchaka pitta. So we may give them an adrenal tonic if they're tired, because it's got the shatavari, bala, brahmi for the mind, and a little coriander and cardamom in there. So basically, it's a lot of shatavari. It's good for a little bit more anxiety and nervousness. And then, of course, to help people to improve their digestion, because a lot of times people their digestion's poor because of snacking, grazing, not eating on regular times. So we have to give them digestive aids to increase the digestion gently and make sure they still don't get acidity. So this type of person, we can't give them ginger, black pepper, all of these other digestive aids we have are all warm and heating. Trichottu, long pepper, ginger, chikrat mul, they're all hot. So we have a special digestive tea here, Pitta digestive tea, gently strengthens digestion before meals, and it can help reduce appetite between meals. So it's often given to the same person who's got this hangry appetite and gets acidity. But sometimes these people have poor digestion, they're not hungry, and they don't get hungry till later in the day, and then they get the acidity. So we want to actually give them something gentle to stimulate their digestion and get the fire going, get the appetite going without increasing the stomach acids or heat. So that's what we would use. And then, of course, people still need to have some flavoring to their food, because if you take away the hot spices, the ginger, the black pepper, the sour taste, they say, oh my God, the food is so bland. But you still can have tasty food and be bland. I mean, it's basically a bland diet. If you have bad chronic GERD, you're going to get a bland diet. But there are some spices that can make your food tasty and remove the bad bland taste. You're not just eating bland food. You're having kind of like tasty bland food. It's still bland to most people, but you can add some flavor to it. We covered already a few of these spices, fennel and coriander. But here we have a seasoning just for this type of person. So, if they have their own seasoning, fine. But we make one here. It looks like it's got a lot of turmeric, but there's actually more coriander in here. So coriander's first, fennel second. So it's very sweet. We call it sweet Pitta seasoning. And there's a little cumin. It says mint leaves, but I make this here, so I know this is not mint. This is actually spearmint. Turmeric, dill, which is safe, cardamom, and a little bit of pink salt, and very little bit of asafetida because it's very, very hot. So it's just a pinch of asafetida in there, probably. It's like we have to measure it out very carefully. But it's mostly coriander, fennel, and turmeric. And so that gives a flavor to the food, helps the digestion, makes it not so bland, and doesn't increase the acid reflux and GERD. Now, other little home remedies include aloe vera. Aloe vera is very cooling, very soothing, helps the esophagus heal from wounds, keeps down acidity, cools the body, helps with inflammation. And so it can also be included, particularly if the person's got some constipation. Most of our herbs for constipation, again, can be a little strong, can be a little warm. So we use aloe and other types of herbs like trivet and amlaki that can help keep the bowels moving, but not increase the heat and acidity. So person will, if they do an appointment with me, a complete holistic treatment will change the eating habits, stop the snacking, stop the sour foods, stop the spicy foods, start eating on a regular basis. And they can take one of these post-digestives, either the abdominal pain, if it's severe, they got a lot of pain, the stomach ulcer, the acidity formula, if it's pretty chronic with every meal, Pitta post-digestive, if they're just getting it sometimes or feel just a little burning. Often the tea is included in almost all those cases. And if it's a really bad case and it's chronic and they're getting it between meals, or particularly when they lie down at night, then we give them the calm belly tea. Now, I've had people tell me they've mixed these together who had strong acid reflux issues. They said right before bed, to get rid of their acidity, they had calm belly tea, and they put a little bit of the acidity formula right in it, and they drank it down, and they snuffed out their stomach acids, and even they went to sleep and lied horizontal. The acids didn't come up and bother them. So, sometimes everybody's a little different. And as the condition improves, generally you can start reducing down some of these herbs. Remember, herbs are not the same as pharmaceutical medication. You don't take them forever. They have a job to do. They're bringing down acidity in your stomach. They're coating your stomach lining, bringing up the stomach mucosa, and healing the esophagus in some cases. And once the job's done, you could just take these herbs only sometimes as needed if you follow the diet to avoid the foods and the eating habits that create the problem in the first place. It's a very straightforward condition unless you have a stomach infection, and then it becomes a little more complicated. We have to put some other herbs in with it. We'll usually just add them into one of these formulas like neem, kalmeg, to fight the infection in the stomach. Maybe we give neem capsules as well to fight the infection as well as keep the acidity under control. And of course, once the throat has been damaged or the esophagus has been damaged, the person can have difficulty swallowing. This can be another complication that needs to be addressed. Aloe is very good in that sense because we know aloe vera helps with the healing of wounds, healing of scars, and this will help, again, to coat the throat, help the throat to recover from the damage from this acidity and GERD. So I hope that helps you folks to understand that this condition is very treatable, has a lot to do with your eating habits and your diet, and of course, your original body type or prakriti. There's certain people like Pitta Prakriti people that have a tendency to get this condition anyway their whole life. So there's certain people have a tendency for it, then they're eating the wrong foods, they're having excess sour foods, excess fermented foods, excess spicy foods, and then this leads to the condition, and then they cannot stop it, and it becomes chronic, and then it has to be healed using the herbs. And once it's healed, maybe just a few weeks or a month, then they have to follow the diet for the rest of their lives to avoid a reoccurrence. Of course, many clients I've treated over 20 years who actually recovered and were very happy. They gave me testimonials. I have a whole category of testimonials on acid reflux and GERD in my testimonials list. I have so many of them. And so they even give me the testimonial. Then 2, 3, 4, 5 years later, they got it back again. And that's generally because they forgot the whole diet and they started doing sour foods, hot foods. And I forgot one more category that has to be avoided, and the acidic foods are nightshades, tomato sauce. So usually the worst food for this condition is hot, spicy tomato sauce, salsa. So we get, Hispanics, Pakistanis, and Indians. We're having this every day. And now they have this chronic acidity, or as a doctor would say, GERD. And, they're still continuing to eat the tomato sauce, the spicy foods. And many of these people, they can stop these foods right away. And just with only a short period of time using the herbs, get it under control, as long as they don't go back to the foods. But often people forget. After a few years, they go back to their hot, spicy foods, and the whole condition comes back. And sometimes they can't even control it on their own by eliminating the foods. They have to come back, reorder the herbs, be more strict with the diet, and recover. And then they'll go for 2 or 3 or 4 or 5 years more, and again, forget everything I told them and let it come back. They always have a reason, like, I got married to an Italian woman and she cooks tomato sauce all the time. And then now I got acidity came back. So, it's very treatable, has a lot to do with your eating habits, and mostly has to do with the foods that you're eating that are incompatible for you and your type of person who has a strong appetite, which is a result of strong stomach acids. So again, hope this helps you out. Feel free to contact me if you like more assistance and guiding you through eliminating this condition and having a better quality of life. Thank you very much, ladies and gentlemen.